Hi, I am Dr. Gokhale, heart and lung surgeon, practicing at Global Hospitals, Hyderabad. I also do heart and lung transplantations. We all know how important heart is. Unless the heart works well, other organs will not be able to work very well. You know, heart has to pump oxygenated blood to the tissues and then take away the carbon dioxide and the impurities from the tissues to the lungs and kidneys. Sometimes this heart can also get into trouble, and this will lead to a lot of difficulties like breathing difficulty, swelling of the feet, and palpitation, not able to sleep flat. Many of these things can happen, and that will interfere from doing our regular work. Most of the times, heart is normal at the time of birth, but gets problems later. However, sometimes the development of heart can be abnormal. That is, when the baby is growing inside the womb of the mother, heart may not form normally. This results in many problems like holes in the heart, you might have heart, and similarly blue baby syndrome, like that. Now, some of these conditions require very immediate treatment. Immediately the baby is born, baby looks blue, or when baby is taking milk, will not be able to suck the milk properly, gets tired, not putting on weight, or getting repeated respiratory tract infections. Then some of these children may be having a heart problem. And when you take them to a heart doctor, they will do some tests including echocardiogram, make a diagnosis. Now, depending on the severity of the condition, they may require surgery or they may not require anything. However, for every problem, we need to know when they require surgery, if they require. Because sometimes we see children who would have been cured had they been operated earlier, like the age of 1 year, 2 years. But sometimes they are not diagnosed properly. They come later at the age of 10 or 11 years. By that time, nothing can be done. So if you find any of these symptoms, then better to see a cardiologist so they can make the diagnosis. Most of the times, heart is normal at the time of birth. As we grow along, this heart can get affected by various problems. The commonest is coronary artery disease. You know, heart supplies blood to all the tissues in the body. However, heart also requires oxygen and nutrients. It supplies itself by giving blood vessels called coronary arteries. Now, through these arteries, normally blood goes to supply oxygen and nutrients to the heart. Sometimes with the aging process, or because the person has got a diabetes or high blood pressure, or maybe they are smoker, obese, high cholesterol levels like that, there will be deposits of fat within these coronary arteries. Now, this prevents blood from going to the tissues because there is a block there. And if this block becomes severe, then one can have a heart attack. And if it is less severe, they get chest pain. When they are walking a little distance, they get pain in the chest, somewhere here, sometimes into the shoulder, sometimes it feels more like gas trouble. Anyone past 30 years who develops similar symptoms, that is pain or discomfort in front of the chest, especially when they are walking, and when they sit, the pain settles, it is associated with sweating or fainting sensation, one must see a specialist to exclude heart problem.